What are the challenges which are associated with a field-based research? Whenever you formulate a research, then the next step that comes to you is going to the field and collecting the data. For every public health scientist, that is one of the most fascinating aspect of their work, as well as the most challenging one. In the library, you can do all the things right in the comfort of all modern amenities, but once you are in field, you are in the hustle bustle of day-to-day life. You are facing all the pollution, all the hardship that nature can offer you, and then you still have to do a sincere, honest research. To do that, the first step that is involved is taking all the permissions from right authorities. Whenever you are visiting a village or a slum or an urban community, make sure you have taken permission from local authorities. If your research involved any medical intervention, then you also have to register your research with the authorities with human trial registration, because that will be considered a human trial. If it is socio-economic, then human trial registration is not required. Clinical trial registration will not be required, but still ethical clearance should be there. You should have handy your ethical clearance from your institution where you are doing the research. Then individual local authorities, you take permission. Then every individual with whom you are administering your questionnaire, you need to provide them with information. What are the implications of research, pros and cons of research, and then only if they give you consent, you can take answers, you can take their responses. In taking response, there are two big challenges again. People don't know you, so sometimes they are friendly, but many times they won't be so friendly. So it's always an advice, especially coming from more than a decade of experience, please and please involve local people. Please make sure before starting the research that you have handful of local people whom you have made understand the value of research, how the research is going to help the community. Once some people from the community, and if they understand why this research is so important, they will be very handy and they will be doing the task of convincing people to participate in your research. So this is not to be forgotten, most important part of research. Thirdly, sometimes since in India past thousands of years we have developed more than 25 different languages which are very popular, and sometimes coming from one part of country you don't know the language of other communities. So to bridge the barrier of language, you need to recruit local people who can administer the questionnaire, and also before applying the questionnaire, please with some help of some expert, make sure that they have passed your questionnaire and they have found that it is not offensive any which way to the local community, because many times in translation you come up with some words or something that is not so suited with their local culture, and we have such diversity that we need to be very, very cautious of cultural barrier also. And then family structure, like if you are talking to some female, whether their community or whether their family practice allows them to talk to you or not, talking to children, talking to elderly. So what kind of respect you need to give them, what kind of social salutation you need to provide, what kind of dress you need to be in, your dressing as well as dressing and cultural aspects of the community, both are to be respected if you don't want to find any cultural barrier. After that, as I said, it's always good, I repeat everywhere I'm teaching the public health scientists, try to give something to the community right at the time when you are administering a questionnaire or collecting the data. Provide them with some knowledge that is really helpful to them in their day-to-day life. So that way you make community trust you, you give them some benefits, so community doesn't feel any kind of barrier sharing with you the data. And being public health scientists, we are and we should always be sharing something that is good for the community. So with these things, summarizing again, taking all the permissions, taking help from local people to tackle the language barrier, involving local people who understand local language, and giving something back to the community. With these 4-5 things, you won't be finding any difficulty being in the field. And then the last thing, Indian geography also is diverse and sometimes really challenging. So before planning to go to a particular place,